Hello, my name is Sam.
I'm Akezhan.
Nischal.
Okay, and our grand round case study was based on a 30-year-old woman with decreased visions and headache.
Hey Sam, would you stand in front of the podium because there's a couple people on Zoom that...
Oh, okay. For recording and stuff.
Yeah. Well, they're on Zoom.
Okay, so these are our objectives, sort of the structure of the presentation. We're going to start with clinical history, then move on to differential diagnosis, clinical anatomy discussion, and treatment. I'll start us off with clinical history. So our patient, a 30-year-old pregnant woman, has had a history of Lyme disease that was treated with amoxicillin, which is a medicine commonly used for the beginning stages of Lyme disease. And she also had extra medications, including prenatal vitamins and ferrous sulfate. She has had no history of using tobacco, alcohol, or drugs. And in terms of family history with diseases and such, her brother has had childhood epilepsy, and her mother has had macular degeneration. Now, when the symptoms first came out and she was examined, it was during her third trimester of the pregnancy. She's had symptoms such as headaches and migraines, and decreased vision in the right eye. It seems that in the right eye only there was a new development with dim colors, low light perception, and soreness, but no pain. There was also problems with color identification. This led to monocular vision loss, which is losing vision in one eye. Her left eye was completely normal and not affected. She's had no response in the right eye from the vision field test, and as mentioned earlier, there was problems with color identification. So then she was hospitalized for 5 days-ish. During that time, her vision was not restored at all, but she's had a little more improvement with color identification, being able to see like hands waving and shadows and movement. But after a month or so of being discharged, she came back for a follow-up, and her vision has gotten worse over time. And the color identification has gotten worse too. It was to the point where she could not see any movement whatsoever from her right eye. After re-examination, it was found out there was no light perception in the right eye whatsoever. An afferent pupillary defect in the right eye. She failed the visual field test yet again, and the Ishihara color test failed with her right eye as well. And if you guys are not familiar with the name of the Ishihara color test, it's that thing where there's like multicolored circles, and there's like a different color like number in the center, like orange background, like a blue sevens, stuff like that.
So in order to accurately identify the final diagnosis, come up with the final diagnosis, we need to first identify the locality of the problem. And there are 3 potential sites where the problem might be lying. The first one being the eye, the second one being the optic nerve, and the last one being the visual cortex of the brain, which are the 3 essential parts of the visual pathway. The examination by an eye specialist did not reveal the cause of the vision loss because the rods and cones, which are the 2 types of photoreceptors, were not damaged. But our patient was still experiencing problems with vision loss and with color discrimination as well as light perception, which leads us to shift our focus, to shift our gaze from the eye to the optic nerve and the visual cortex. And for that reason, we performed a fundoscopy. Our next misgiving was that the patient got infected with either Bartonella, Hensley, or Toxoplasma gondii, which are the 2 types of bacteria that can infect the eye. However, the fundoscopy, which is a medical examination of the fundus of the eye, did not show any inflammation, which is characteristic of the invasion of the eye with these bacterial agents. So we eliminated the possibility that it was a bacterial infection. However, what the fundoscopy showed was that, as you can see from the panel A, which was performed, which is a photograph taken 8 weeks after the onset of the symptoms, there's an increased pallor in the optic disc. There's some swelling indicated by this asterisks, and there is also the abnormality in the vessel, like here, pointed by the white arrow. And then we performed fundoscopy 8 weeks later from the first one, and it revealed increased pallor of the optic disc, decreased swelling, as well as a greater prominence of the abnormal vessel. And these three are consistent with what is called optociliary shunt vessels, which are themselves associated with the optic sheath meningioma, which is a type of cancer that grows on the sheath of the optic nerve. And optociliary shunt vessels occur when the retinal vein gets occluded somewhere along the optic nerve, which is why the blood needs to go through other vessels. So we were suspecting some kind of tumor.
Was that associated with an increase in the scotoma, the blind spot, or did they mention that?
They did not mention that. You mean the optic disc?
The blind spot that you have that's centered on that part of the retina?
They did not mention that. So, yeah, I don't know. But the MRI scan shows that, if you compare the left eye and the right eye, there's some unusual formation here, which might be indicative of the tumor that we're suspecting she has. The other MRI scans also confirm our suspicions, because here, if you compare the left eye and the right eye, there's also some kind of very unusual formation here. And these two photographs were taken 2 months apart. And as you can see, after 2 months, it got slightly enlarged, but it didn't expand beyond its orbit to the surrounding adipose tissue.
So just to talk a little bit about what the optic nerve sheath is.
Nischal, would you stand in front of himself just so that Epstein's speaker?
The optic nerve sheath is the membrane that surrounds the optic nerve right here, and that's where the locality of the tumor was. And the photoreceptors, the grots and cones, were normal, so the physical presence of the tumor itself led to the vision loss for the patient. And that's because it compressed the optic nerve at a certain time point that led to the reduction of or the damage of nerve transmission from the photoreceptors to the visual cortex. And so they did a biopsy analysis for this patient, and optic nerve sheath biopsies are very rare just because it's so close to the optic nerve itself. And so there's a very high risk of damaging the optic nerve itself. But the doctors deemed it necessary, and that it's not a significant risk for the patient because she had the vision loss for such a long time. They thought it would be successful and not a significant risk for the patient itself. And you can see in panel B that the optic nerve sheath is twice the size of the normal size for the sheath itself. So with the biopsy, they wanted to figure out what type of tumor it is. They were suspecting meningioma, but glioma was also another possibility. So with the histopathology, you can see in part A, the tumor is shown with the arrow right here with some fat and bone cells too. And then panel C shows the magnification of the tumor itself, which shows a little bit of the nested or the whorled tumor structure of the meningioma, and it's also round to no oval nuclei, which are identifiers for a meningioma and not a glioma itself. And then panel F shows the proliferation of the tumor itself, and they were trying to see if the cancer was benign or malignant, and they found that there was no necrosis or glial invasion, which shows that the tumor is malignant, not malignant, benign. So before finding out what the final diagnosis was, they treated the patient with corticosteroids such as methylprednisolone and prednisolone, and also rituximab, which is a monoclonal antibody, which were all used to reduce the nerve swelling for the patient itself. But at the end, they used radiation therapy to treat the tumor. Specifically, they used proton radiation therapy, which is a new, I think, a little bit advanced technique compared to the normal ones we use for X-ray, which uses photons So it has a higher likelihood of invading other normal cells. Proton radiation is more specific to the tumor itself. And they were able to reduce the tumor. However, the patient did not regain their vision. Thank you for listening.